Thank you, Chairman Waxman, for inviting me to participate today. It's an honor for me to appear with my esteemed colleague from the Senate. And I sit before you today both as a colleague in the House and as a registered nurse. Long before I entered the halls of Congress, I worked as a school nurse and health educator for the Santa Barbara public school districts. My responsibilities then were to make decisions that best met the needs of my students and school district, much as they are now, to make decisions that best represent the needs of my constituents and the American people. As a public health nurse, it was natural for me to reinforce that prevention is a most important component of health education. Teaching young people about healthy behaviors, including the risks associated with unprotected sex and teen pregnancy, are important messages that need to be conveyed always in alliance with the parents involved. I know from my firsthand experience what does and doesn't work with youth. That is why I promoted comprehensive health education for all students, including age-appropriate information about reproduction and decision-making associated with sex, always with the parents' permission. Knowing about mitigating the risk of sexually transmitted disease and ways to prevent pregnancy are important life skills needed in today's world. Withholding this information from teens does a great and perhaps dangerous disservice to them, and one that runs contrary to my training and education as a public health nurse. In my work as a school nurse, I've been part of many curriculum review panels regarding sex education at both the school site and the local school district level. These panels are always centered around parents and include teachers, administrators, board members, and often community health professionals such as pediatricians. As a school nurse, I also had the privilege of directing a program for pregnant and parenting teens, which allowed them to stay in regular high school with their peers. Part of this program was, of course, to provide care for their children while they were studying and in class. But more importantly, this teen parenting program provided education on life skills with an emphasis on parenting, as well as education on how to prevent or delay further teen pregnancies. After all, teen parents are all too likely to have a second birth relatively soon. About 1/4 of teenage mothers have a second child within 24 months of that first early birth. Mr. Chairman, according to a 2005 CDC study, 46.8% of all high school students reported having had sexual intercourse. For high school seniors, this figure reaches 63.1%. The bottom line is, as much as parents and teachers and all of us alike stress abstinence among teens, sexual activity is a reality for many young people. So what can we do to confront that reality? Some say that abstinence-only education is the answer, but claiming that the only proper information to share with teens, even teens who are already parents, is abstinence only and nothing else, means withholding scientifically based medical information. This is completely unrealistic in my view. Of course, abstinence is at the core of any comprehensive sexual education curriculum. Practicing 100% complete abstinence is 100% effective in preventing pregnancy, and that's a primary message. For many young people, this message reinforces positive behaviors, but it is not realistic to expect such behavior from all teens. So the best thing we can do to protect young people from the negative consequences of unsafe sex is to give them the information they need. We know this works. A national campaign to prevent teen pregnancy study revealed that over 40% of the comprehensive education programs that were evaluated delayed the initiation of sex, and more than 60% reduced unprotected sex. Furthermore, no comprehensive program has hastened the initiation of sex, according to this study, or increased the frequency of sex. Conversely, just last year, a federally funded evaluation of the Title V abstinence-only programs conducted by Mathematica Policy Research, Inc., found no evidence that these programs, that's abstinence-only, increased rates of sexual abstinence. Scientific study after scientific study has shown that these programs are ineffective and often contain false information, something bears out in my own anecdotal survey of them. I urge us not to add to the $1.3 billion in federal dollars that have been invested over the past decade in programs that are ineffective and many of them downright false. And I'm proud that my own state of California has rejected these dollars from day one. In fact, California is the only state that has never applied for and never received Title V abstinence-only until marriage funding. California would have been eligible for over $7 million in Title V abstinence-only until marriage funding in fiscal year 2007, but the state chose not to apply for these funds due to the extraordinary restrictions upon how the money must be spent. This was based on the state's previous experience in the 1990s with a state-funded abstinence-only education program that proved to be ineffective. Evaluation of the program proved that youth who were given abstinence-only education were not less likely than youth in control groups to report a pregnancy or a sexually transmitted infection. And California isn't the only state to draw these conclusions. The Kansas Department of Health and Environment conducted a 2004 evaluation of abstinence-only until marriage programs, and this evaluation found that there were no changes noted for participants' actual or intended behavior, such as whether they planned to wait until marriage to have sex. The evaluation also revealed negative changes in attitudes. After participating in abstinence-only until marriage programs, students surveyed were less likely to respond than the teachers and staff they were less likely to respond that the teachers and staff cared about them, and significantly fewer students felt that they have a right to refuse to have sex with someone. Researchers therefore concluded that rather than focusing on abstinence only until marriage, data suggests that including information on contraceptive use may be more effective at decreasing teen pregnancy. This evaluation is, unfortunately, all too typical of the result of the abstinence-only education programs. Mr. Chairman, as of 2008 January, 17 states have rejected Title V abstinence-only funding based on sound public health concerns and because governors have deemed the programs to be inconsistent with their state's values or public health mandates. I commend these states for making smart decisions regarding the health of their young people and listening to parents who want more comprehensive education for their children. Recent polling reveals that a vast majority of adults support a comprehensive approach to sexuality education. According to a study conducted by the National Campaign to Prevent Teen and Unplanned Pregnancy, 78% of California residents support programs that teach about abstinence as well as how to obtain and use contraceptives. Furthermore, residents believe that the federal government should pay for this instruction. That is why I'm proud to be a co-sponsor of legislation such as the Responsible Education About Life, or REAL Act, and the Prevention First Act. It is in the best interest, I believe, of public health of our entire society to ensure that all students are receiving scientifically and medically accurate information that will enable them to make the healthiest lifestyle decisions for them. Furthermore, I believe that we must discontinue any funding that's federal for abstinence-only education programs. I believe they've been a waste of taxpayer dollars and have produced no positive results. As a member of Congress, again, as a registered nurse, this is a position I encourage my colleagues to adopt, as we have a responsibility, I believe, to protect the public health. We should follow the recommendations of the Institutes of Medicine, and I quote now, Congress, as well as other federal, state, and local policymakers, eliminate the requirements that public funds be used for abstinence-only education, and that states and local school districts implement and continue to support age-appropriate, comprehensive sex education and condom availability. Thank you again for the opportunity to testify today.
Thank you very much, Ms. Capps.